How can we chart the course for leadership in modern medicine? I'm Annie Gibbins. Women's Biz Leaders starts now. Welcome to Women's Biz Leaders, presented by Women's Biz Global, where each episode we dive into the journeys and successes of remarkable women in business. In this episode, we envision the future of leadership in modern healthcare. What a great topic. Joining me today is Dr. Karen Price. Welcome to the program.
Hi, Annie.
So wonderful to have you here, a woman in leadership in medicine. It's such an important area. I'd say one of the most important areas that we need to be leading well. Is this an area that requires more respectful conversation, more thought leadership? What strategies are you putting in place in the workplace of medicine to actually help better leaders in this area?
Well, first of all, the workplace of medicine is so large that you've really got to focus on your own circle of influence and figure out very quickly the areas that you can work on, because no change comes about holus bolus. You've got to focus on the small things around you. And what I encourage many women GPs I know, because I work in general practice, is to find your voice. And it's about being able to speak up and perhaps knowing that someone's going to resist you. How do you manage that? How you can speak assertively and confidently, because many women have many areas of expertise that medicine is longing for.
Absolutely, absolutely. Is it an area that there are equal amounts of men and women in as doctors? Is this an equal profession?
It used to be about now, we've got about 50-50 men and women, but we've now got about 65% or so of women entering the profession. And we've also got, in general practice, we've also got falling enrolments into general practice as a whole. However, in some of the surgical specialties, there's a clear bias towards male surgeons in many cases, and but there are some specialties like endocrinology or obstetrics where it's more women. So there's a bit of a change coming, and I was of the cohort where it was said that women were wasting a medical degree because they'd only go off, get married and have children. So we started off with this terrible burden that we were somehow taking the place of a man unfairly.
Wow. Incredible, isn't it? And not very long ago that
not
this
very long ago
was there. So we are definitely pioneering this space. Now, you have a platform called GPs Down Under. And how are you using this to improve general practice, and particularly women in general practice?
So GPs Down Under is a forum of about 11,000 GPs from around Australia. General practice is a fairly isolated profession. We have one room, one patient, one consultation at a time. In hospitals, my daughter's a young physician, and in hospitals they do rounds and they have meetings with complicated case discussions with multidisciplinary teams, putting their input, and that's all paid for time. In general practice, you're making decisions, often multiple decisions in the same time in the room, so it can be very difficult. So this forum hosted occurred at the same time as my thesis, which was a PhD I've just finished.
Congratulations.
Yeah, thank you. And it's about how GPs can talk informally with their colleagues, not just anybody, but someone they trust, who they can talk about a more difficult case and find out answers that they might need for that particular case. And that's modelled on the forum, where you can present an anonymised case with the consent of the patient and talking through some of the issues, where you might get some inputs from other specialist GPs who can help you perhaps navigate or some tricky judgment decisions or management decisions, or even consultation issues where you've got a patient who may have difficulties understanding or who may be triggering you. And it's been a bit of a rodeo, because there's lots of personalities. 11,000 GPs will have a whole range of the representative of the community. So we've got some strong voices, and the predominant gender is female, but the predominant voice is still male. So this is an issue that I still say on the women's forums, because there's lots of other forums that are devoted just to women. You need to speak up. When a man says something, that if you don't agree with it, say so.
Yes, exactly. Exactly. And we are just way too slow to do that in all professions, definitely. Now, you You campaign, or you work mainly encouraging private practice in medicine. And is this because of this isolation? This is because more work needs to be done here compared to the multidisciplinary environment in a hospital? Or is it, do you actually think, you know what, it actually results in better health outcomes?
Well, we do know Australia has one of the best health systems in the world. And what's happened for general practice is, and across the board really, Medicare has been frozen and not sufficiently indexed. So we have a balance of public and private. I'm not really for one or the other, because we don't really want to have an American style health system where there's a large GDP spend and the outcomes aren't always good. I talk a lot about the inverse care law, which is the people who have the greatest burden of healthcare often have the least ability to pay for it. So we've had a very challenging political time, and the advocacy has been about you need to be able to cross-subsidise within your practice, so you charge people who can afford, so that you can see people bulk billed who can't afford. Now, everyone wants everything for free, but it's not possible to run a general practice easily on purely bulk billing now. You will become insolvent, and we know that with good business practice that is not what you want to do, and the whole area will lose general practice. So we've had to look at the sustainability from a business point of view about how do you keep providing quality of care. It does need a certain amount of financial basis. So financial literacy for doctors, financial and health system literacy for patients is really important to understand that, you know, if you have challenges with paying for your medical bills, your doctor is probably open to a conversation, depending on the practice. And it is a very difficult situation for us because the Medicare is the patient's insurance. It's not something we determine. It's what the government has set as a subsidy for healthcare, and it hasn't kept pace with the cost of delivering quality healthcare.
It must be so heartbreaking for physicians to actually think some patients aren't seeing me because they can't afford the care. That's the reality, right? And you wouldn't expect that in Australia. No,
what's really grieving a lot of doctors, and I think contributing to workforce issues, are that people are finding that we're developing a two-tier health system. So if you are not privately insured, if you haven't got cash for gaps, then, you know, potentially your choices are more limited by that. And we know, for instance, that a patient in a public hospital can get all of their allied health care pretty much. There's physio, their dietetics, occupational therapy, psychology. But once they go into the community, that's not funded unless you've got private health cover. So we're advocating at a government level for the most vulnerable, but we're also supporting the health system by saying to doctors, we need to charge those who can afford to pay so that we can cross-subsidise. And it's a very, you know, health system funding is debated all over the world, so I don't want to get into the depths of it, but it's a very difficult, but it's mostly political.
Which is sad, but the reality. Hard work. Now, you mentioned before you've got this 50-50 situation often, but the women aren't feeling comfortable to have their voice heard, to be able to go for those positions, possibly to be able to really optimise their ability as a doctor or a surgeon, or the things that they hope and dream for. So how do you promote gender equality, gender empowerment in this kind of medical leadership space?
What's fascinating is we did a study in 2015 on women's leadership, and the women in medicine have experienced leadership in high school. They were leaders in high school, often school captains. They had a whole lot of leadership in debating teams, and then something happens to them within medicine where they lose confidence. Now, maybe it's because they feel very junior. The men don't seem to lose that confidence in the same way to speak up. So we talk a lot about that, about being able to speak up, having confidence given back to them. And I know myself that there are times when I've gone, oh, really, should I do that? And it just needs another voice next to me to say, yes, you can. You know, so I had a leadership forum yesterday on the weekend with a whole lot of female leaders, and they were all there supporting each other who've been in senior leadership positions, but supporting each other to give confidence for the next steps, for taking next steps. So having those advocates, having people that you can really trust, who are going to celebrate your successes, rather than feel a bit jealous of them, frankly. So, you know, you've got to find your people. And when I was president of the college, I made sure I had people around me that I trusted and I loved, and I hopefully trusted and loved me. But they were able, I gave them permission to say, you need to speak to me so that if I'm going off track, I want you to actually give me positive, and obviously positive, great, that's lovely, but also negative feedback, not you know, to improve the whole situation. So you've got people that you trust in that trusting relationship, so that you know that your own self won't be attacked, but your skill set can be improved.
Now, you've done a PhD in this space, and I'm assuming there's a breadth of hopefully growing research data to support the issues and the concepts that we're talking about today. Do you have any key findings in the research that's actually directly influencing the way you go about your role and the leadership change that you are helping others pursue?
Yeah, so my research is along an informal supervision model. So doctors hold a lot of trauma. We see people die, we see children die, we hear horrendous stories of abuse and so forth, and this really affects them. Now, if that's held too tightly and not addressed, that can affect patient care because you can become detached or burned out. And a burned out doctor or a detached doctor, you're not going to feel as connected with. So having a close circle of informal other doctors who understand the work that you can debrief with, it's not counselling, it's a different type of discussion, really helps doctors get back on track. And it's all about our cognitive ability to use empathy and not to shut empathy down when we're stressed or burned out. So understanding the dimensions of empathy and having that observer mind, understanding how that empowers relationships. So people in relationships have work to do. Whether we're married or whether we're in the workplace, there is the work of the relationship. How do you get to that point is by having trust and empathy, of course, and unconditional positive regard, which is lovely. Probably the closest we get to that is a mother and child, ideally. But having time where you play, having time where you break bread, where you have a lunchroom which supports that kind of discussion and discovery about finding out who your people are, and then being able to have this trust in this person to come back to and say, actually, I'm going to talk to Jill or Jane or Andrew about this issue because I know I can trust them with this very deep and vulnerable part of me. So there's a whole psychological way of being vulnerable, which is a strength, but it needs to be in a safe environment.
We're going to finish up there. That's an incredible point that has been reflected on other guests on my show as well, the need for more vulnerability, the more that we can actually share how we're feeling with others and get support for that, the better. We're going to be a stronger cohort together. And I think it's been an enlightening conversation, thinking about, next time I go to a GP, thinking it could be a very lonely place. They are working in an isolated room, patient after patient after patient. So it's actually great that you are championing change in that area, and I know many are actually building and supporting this profession and actually having very specific programs that are embedded to make that happen, and supported by research, which is not surprising in medicine. So thank you so much for being on the show, Professor Price. And thank you so much for joining us. I look forward to seeing you next episode very soon.
You're watching Ticker. We'll have more in just a few minutes.